Hi, podcasters. I'm Dr. Mary Larajani.
And I'm Dr. Rina Lau.
And welcome to the Skin the Surface podcast, where we are going to address various topics related to your skin. Welcome back, podcasters, to Skin the Surface. Today we will be discussing one of the most common reasons why people visit their dermatologist, the skin cancer screening exam. Today's episode is all about what to expect when you're expecting your first full skin exam. Why is it important to have a skin exam? Well, skin cancer is on the rise, and it's the most commonly diagnosed cancer in the United States. According to the American Academy of Dermatology, 1 in 5 Americans are diagnosed with skin cancer.
That is a striking statistic. That means that every one of us knows someone with a history of skin cancer, whether it be a family member, friend, or coworker. Speaking of statistics, with more than 1 million Americans living with melanoma, having a full skin exam is even that much more important.
So, Rina, who needs to come in for a skin check and how often?
Well, we see all types of patients from all walks of life coming in for a skin exam. Sun exposure history is one of the most important risk factors for skin cancer, which include significant sun exposure, tanning bed use more than a handful of times, or blistering sunburns. Blistering sunburns are unforgettable as they can not only be painful, but certainly put a damper on your perfect vacation. Believe it or not, one blistering sunburn during childhood or adolescence may double your chance of developing a melanoma. Other risk factors include a family history of skin cancer, a concerning spot, or many moles. So when in doubt, check it out.
That's a great motto, Rina. Just to include a few more examples, patients with a history of organ transplantation or a weakened immune system, those who've had radiation or chemotherapy, those with atypical moles, or even other cancers such as breast, prostate, or thyroid cancer, and even certain genetic conditions are at increased risk of developing skin cancer and are recommended to have a yearly head-to-toe check.
Those are some great examples, Mary. In general, we recommend that at-risk patients have yearly skin cancer screening. However, we have some patients that we see more than once a year. These patients have a history of skin cancer or precancerous lesions, and we keep a closer eye on them with more frequent exams.
There's no time like the present to become proactive about your skin health, and with the new year ahead of us, this just may be the resolution that you never knew you needed. Rina, can you tell us more about the exam itself?
Yeah, of course. Your dermatologist will examine any part of the skin that you show us, so whatever part we see, we assess. So if you visited a nudist beach here and there, we should probably check your entire skin. However, for the average person, feel free to leave your bra and underwear on. Many of my patients come in apologizing in advance for not shaving, but believe it or not, this is not a requirement, and the most important thing is that you feel comfortable during the exam.
It's also important to remove your socks and shoes because the examination of the skin includes your hands and feet. My patients are always surprised when I tell them that you can get moles on the bottom of your feet, because as you can expect, most people are not putting sunscreen on the bottom of their feet. Many people don't know that Bob Marley actually had a melanoma on the bottom of his foot, and that's why he passed away. That just highlights that even people who don't burn easily may be at risk of skin cancer.
I couldn't agree more, Mary. It's so important to realize that people with skin of color are also prone to skin cancer, particularly in areas that aren't commonly exposed to the sun, like the palms of the hands, the soles of the feet, the groin, and inside the mouth. They may also develop melanoma underneath their nails.
And that's why we strongly encourage patients to remove all nail polish before their skin exam so that we can closely examine the nail. So we've mentioned melanoma, and this, of course, is one of the most serious and potentially deadly skin cancers. But it's actually not the most common skin cancer. It's the non-melanoma skin cancers that are most frequently diagnosed, with the most common being basal cell skin cancer, and the second most common being squamous cell skin cancer. These skin cancers can start as pink, crusted, or shiny bumps that bleed without you even touching them. They may even look like a pimple or a sore that doesn't heal. Even though the non-melanoma skin cancers are most commonly seen in people who don't burn easily, people of all skin colors can get these types of cancers. This is why I encourage all of my patients to take an active role in their skin health, because when skin cancers are found early, they're highly treatable. So Rina, what can patients do at home to be proactive about their skin, and what do they need to look out for?
That's a great question, and one I get frequently from my patients. In general, checking your own skin once a month is encouraged. As soon as you come out of the shower, do a good sweep in the mirror and keep your eye out for any concerning features, including a spot that has changed in size, shape, color, or new growth. And when looking out for melanoma, it's helpful to use the acronym ABCDE. A stands for asymmetry, which means one half of the growth looks different from the other. B stands for borders, which means a growth has irregular or ill-defined borders. C stands for color, which looks different or darker when compared to other moles, or has multiple colors throughout. D stands for diameter, generally larger than the size of a pencil eraser. And E stands for evolving, such as a mole you had for a while that's now changing in appearance or bleeding without you even touching it. I always joke with my patients to check their birthday suit on their birthday.
And to add to that, practicing sun-safe behaviors, including wearing broad-spectrum, water-resistant sunscreen with an SPF level of 30 or higher, wearing sun-protective clothing, including a wide-brim hat, avoiding peak hours of sun, and seeking the shade are all ways in which you can protect your skin and reduce your risk of developing a skin cancer. So that's all for today. We hope you gained a greater understanding about the importance of a routine skin exam and learned some tricks to screen yourself at home. And as Rina taught us, when in doubt, have your dermatologist check it out. Tune in next week as we discuss anti-aging skincare products and the 3 products that every single person should be using on their skin.